we are live. Welcome to another episode of Conversations with Dr. K. I am super excited today to have my friend and colleague, Paul Krauss. Paul is a licensed professional counselor and trauma therapist at Grand Rapids, Michigan. He currently serves as the clinical director at Health for Life Grand Rapids and the Trauma Informed Counseling Center of Grand Rapids. He completed his bachelor's at Michigan State University and his master's from the Chicago School of Professional Psychology. Among his many credentials includes Emdr Level 2, ACRA certification, ACRA trainer certification, and he holds licenses with the Michigan Board of Counseling and Arizona Board of Behavioral Health Examiners. Paul deeply believes that every human being has the potential to transform in a powerful way, no matter their past, their circumstances, or current challenges. Using his 12 plus years of experience and individualized treatment approach, he helps high achievers overcome barriers to growth and helps those suffering from anxiety, depression, trauma, addiction, and other maladies to have a higher quality of life and even recover completely. Ladies and gentlemen, Paul Krauss.
Well, thank you, Karthik. That was quite the introduction. I appreciate that. I'm glad to be here. And yeah, Dr. K, love the show. And I've been tuning in on YouTube and also Instagram. So I'm loving the new format. So thanks for having me on the live.
Oh, absolutely. I've been looking forward to having you on for a while. I was actually on your podcast a couple of years ago, and then more recently, but that's coming up in an episode shortly. And for those who don't know, we're also good friends as well for the last probably 3 years or so.
At least 3 years, something in there.
Something like that. But then he moved to Michigan, as you heard, and
that's true.
So we hang out in the winters when he wants to escape the cold.
Right, when I half live in Arizona.
Exactly. So why don't you tell my audience a little bit about yourself?
Well, let's see. Right now, I first got into EMDR in 2009, so there's that. And I was completely skeptical, but I was blown away in the training and especially with the experiential part of EMDR therapy. So I really tried so many other modalities. I'm trained in cognitive behavioral therapy advanced. I'm trained in just mindfulness-based cognitive therapy, motivational interviewing, so many other types of therapies and counseling that you can utilize, including ACRA that you mentioned. And it's definitely not every client is ready for EMDR therapy or any of its similar therapies like somatic experiencing therapy. But I do find that it is the most powerful tool that I've utilized. So right now, I've been really working hard on bringing EMDR therapy and trauma-informed counseling to Grand Rapids, Michigan. There are some definitely great therapists that were already here doing some of that, but they seem to be kind of spread out among different counseling centers or just private practice people. And there was no real center. And especially as being a male, I found that there were very few EMDR male therapists. So I basically decided to start the Trauma Informed Counseling Center of Grand Rapids. And so that's what I've been working on lately as the clinical director. Yeah, it's at this place called Health for Life Grand Rapids. That's our office. And I've been working on getting a lot of newer clinicians trained in EMDR, as well as other modalities, which we'll go into later. So that's what I've really been working on. I was a supervisor in Arizona, clinical supervisor, and I was a trainer for ACRA for a long time. And I'm supervising multiple clinicians here in Michigan as well now. But I saw how powerful EMDR therapy and just a trauma-informed lens on therapy was, and how non-judgmental and how holistic, and how much clients really felt valued and honored in the process instead of as some sort of like person with a pathology. And they didn't feel shamed or blamed or culturally excluded when you take these types of therapies, which have a huge science empirical backing, yet are delivered in a way that I would say is akin to very client-centered or Carl Rogers type approach, as there, a lot of therapies are becoming more integrated. So I found that it worked so well that I wanted to try to have a bigger impact on the community, and also because I found there was a lot of let's just name names a little bit. Some of the hospitals around here, some of the bigger treatment centers, don't have that much trauma informed, from what I can ascertain, and I've been told this by clients and practitioners who have worked at these places. And just some counselors not having the newer education because they were educated 20 years ago plus, or even 10 years ago plus, before it was a big part of the counseling curriculum in the master's degree. I'm also doing this to try to help other clinicians get this extra continuing education to help their own style and their own practice, and add on to their toolbox. So trying to help the community in that way. So that's what I'm up to. Putting out a podcast episode every month. Your episode, Dr. K, which should be released in late July, if not sooner, but that's the street date so far I've got for it. And I'm still working with clients. I enjoy working with clients a lot. I didn't really ever see myself as a director or a clinical supervisor when I first started this career, but that's just what's happened. And I went with it. So I love it. I enjoy every minute of it. And it is definitely definitely a large challenge for me, because I love working with clients. I could do that every day and be fine with it. But now I've decreased my client load, but I'm going to continue seeing clients to keep my skills and to help people, but also really trying to mentor and educate clinicians, both ones that are new to the field and ones that want a fresh perspective.
Awesome. Yeah,
So
because I think that's something that as professionals, you kind of alluded to the fact that we get trained a certain way, and that really becomes the focal point. And maybe we might add things onto it here and there, but sometimes it's just we seek out things that are familiar. And we'll get into EMDR here in a second, but before I say that, just for my audience, what you see here with me doing this show and anything that you may have gleaned value from, it's not that I wasn't this guy prior to EMDR. I was, but I fell off track and I wasn't able to get myself back on track. And we go into some of those details and whatnot in the podcast I did with Paul here. But it was really at a low point in 2018 when Paul said, dude, you need to get EMDR. And I resisted it. And I said no. And because I had all this, I also had this mental block, like, well, I'm not sick. I'm not, dealing with a mental illness. This is not for me and whatnot. But eventually I accepted the fact that therapy is not just if you're, mentally ill. Therapy is really good for everyone, and especially people that want to just take their life to the next level. So, a lot of what I talk about here on this channel is everyday mental health and the habits, the strategies that are needed to get there, and to take it a step further. EMDR is what changed my life. EMDR is what has allowed you to see me do this right now for you. So, and a lot of that is also thanks to Paul kind of kicking my butt and sending me in that direction to get it done.
Yeah, I was not too gentle with my approach with you. Since you're my friend, I took off my clinical skills and said, get in there. And
it was tough love. I mean,
yeah.
Bring the heat is tough love, right? On the Dr. K show. It's totally out of love. And it's just, sometimes you just need to be told straight up what needs to do, because just the state we're in sometimes. But EMDR, tell us a little bit, just high level, what it is, what it stands for, who's it for, that type of thing.
Well, actually, yeah, I almost want to go backwards and talk about the high performance stuff. So remind me to get there if I don't touch on that. But EMDR is also short for eye movement desensitization and reprocessing therapy. Francine Shapiro, who unfortunately passed away actually Tuesday at 71 after a long illness, was the inventor of EMDR. She invented it in the early 90s. And then refined it over the years to a very highly regarded, empirically proven model. That currently today the EMDR Institute and the EMDR International Association and other groups are continuing her work. I'm actually on the verge of being EMDR IA certified, so Emdr is certified, which is a long process with at least 12 giant steps that I've been working on for a while to add to my training. But essentially, there's so many parts of EMDR that I could talk about, but I think the big part is people want symptom relief. And I think that symptom relief can be anything. You don't have to be mentally ill or have post-traumatic stress disorder or depression or anxiety to want symptom relief. People want to feel differently in their body and their mind. And a lot of counseling in the past focused on thinking and belief systems and maybe some behaviors. And so people really used a lot of willpower, and they really tried to memorize these things and tried to change their perspective. And that stuff does work. It's been proven to work. Counseling is one of the most effective interventions medically. It has a 0.79 effect size that was done with over 10,000 meta-analyses of studies of counseling by Bruce Wampold, who proved that 79% of people that were in counseling improved, and only about 21% either were neutral or didn't improve. And that was thousands of people in each study, over 10,000 studies over, I think, 30 or 40 years. So counseling itself works. We know that. However, some people found that when they went back to their life after counseling or whatever, they would regress into certain behaviors. They would get angry. They wouldn't know how to relate to their partner or friends. And so, or they just started having other things that bother them. So EMDR is about symptom relief in an entire incorporating the body. So that's a unique part about EMDR, is it's working not only on the mind and how you think about your life and how you think about your past and you think about your future, but it's also working on the felt sense in the body, which I think is something that is an important part of health that people don't really realize. How do we feel? Sometimes we feel a certain way, we're just going to stuff our face with food, or sometimes we feel a certain way we don't want to eat, or sometimes we feel a certain way we don't know why. And EMDR works on both sides, which is, I think, really unique. So part of it is, there's multiple sides, but here's the basics. So we all grow up and we have different experiences, and these experiences get stored in our long-term memory. Here's an easy way to see it. Some people have what we call traumatic experiences. I think everyone has at least some type of traumatic experience in their life at any time, whether it was a childhood or adult experience, where it overwhelms the nervous system. And when you're overwhelmed, the nervous system, essentially, your amygdala takes over and it goes into fight, flight, freeze response. Fight, flight, freeze, or even collapse response to keep the body and mind safe. That is what your brain wants to do, and your nervous system is an extension of your brain that goes throughout your body. It wants to keep you alive. So therefore, in this situation, you froze, you fought, you ran away, you collapsed, you didn't know what to do, and only later on did the impact of the situation really affect your emotions and your thoughts. And what happens in those times, depending on the person, is that maladaptive information can be stored in the memory, which ends up looking or coming out. Let me actually, I have a list of the things. Maybe let's go by my memory. It ends up coming out in behaviors subtly, in thoughts subtly. So, such as, it was my fault. I'm unlovable. So feeling like something's wrong with you. That's one of the things. And wishing things would have gone a different way. If only I would have done this and my life would have been different. Taking responsibility for things that aren't your fault. Like, it's my fault. Or feeling that the world is an unsafe place and having to hide from it. So actually, let me just get the list. So hold on one second.
Well, and I'll just continue. And some of those maladaptive behaviors, are the starting point, because a lot of them start, in childhood, let's say before 7 years old. Right.
Mm-hmm.
And at that time, we're so primed to learn and take what we've learned as fact And it's almost the root of a tree, if you want to think of it that way. The seed has been planted, now the root of the tree is growing. And everything that happens, let's say, middle school is a tough time for a lot of people, and going into high school and all these things that people deal with, whether it's at the home or whether it's at school. And now all of a sudden those maladaptive belief patterns that, like Paul just talked about, become more and more true. It goes from something that I believe to something that is. And when it's about yourself, if those don't serve you, now all of a sudden, you're 32 years old and wondering, how come every relationship ends up this way, right? Or I'm unable to I get treated the same way by every boss. Whereas I'm not capable of living out my dreams, whatever it might look like. I can't lose weight, whatever it might look like. It might be some really innocuous event in childhood. That's what I found out through EMDR myself. These were not like
It doesn't have
traumatic
to be a
events.
trauma.
It doesn't have to be a trauma.
Yeah.
But it was something that I took to be fact. Like, I am not worthy. That was my biggest one. Like, I'm not worthy of fill in the blank. So when I talk and bring the heat, oftentimes I talk about, you are enough. I didn't believe I was enough. I didn't believe I was worthy enough. I didn't believe I was capable enough, all these things. And that's what EMDR can help you identify what that is, so that you can start to unwind that. And now all of a sudden, that same event that caused those maladaptive behaviors can actually turn into empowering events when you reprocess it, which Paul will get into.
Absolutely. That's a great, thank you for filling that in while I grabbed my sheet of cognitions. So
we're live, folks.
Well, when you're younger, there's different thinking levels. I won't go into all the psychology jargon, but especially when you're younger, we're all in some sort of concrete or black and white thinking. So things are absolute. So when some adult fails us, we might think, instead of, wow, they failed us because we're dependent on that adult, we might think, I'm weak, I'm powerless, I'm not in control, so I have no control over my life, and I just have to go with whatever comes. Or when we, I don't know, have a friend who betrays us and bullies us, or somebody who, breaks up with us in a relationship, we might not think, oh, okay, that happened, we broke up, or this person kind of backstabbed me, and we're seeing that objective part. Because we went into fight, flight, freeze, we start storing things such as, I can't protect myself, I can't trust myself, I can't trust anyone. And we start believing this stuff internally, and it's mostly subconscious. You see it come out in behaviors, you see it come out in these patterns that you live over and over and over in your life, but you don't know why. And so a lot of people get angry at themselves, they judge themselves, they think, let's just say you got in a car accident and a red car hit you, a drunk driver. It wasn't your fault, but people that have been through car accidents, which is an obvious traumatic event, first of all, they might be afraid of red cars. That makes no sense. Well, every time I see a red car, I think, I'm not safe. This could happen again, right? It's that trigger. It's part of the nervous system's unconscious material coming up into your brain. Or maybe I shouldn't have been driving at night. Maybe that was the problem. I shouldn't have been driving at night. I shouldn't have been driving on that road. I start to blame myself because I want a sense of control and meaning out of this. And the problem is the maladaptively stored memories and events are unresolved. That's why I brought up breakups. That's why I brought up adults failing us. That's why I brought up a friend backstabbing us. That's why I brought up a car accident. These are unresolved events with no redemption, no resolution, no clarity. That's why our brain hangs on to them, because humans want meaning. They want to feel that things are resolved. But oftentimes, when it comes to all those events, we cannot rely on our friend to apologize to us, to tell for a parent or an adult who failed us or hurt us to come to us and do the right thing. We cannot rely on a bully having a change of heart and telling us they're sorry and that it wasn't our fault, that we're actually a nice person and not whatever name they called us. And we can't rely on not having traumatic things happen to us, like a car accident, or an obvious one, a soldier goes to war and loses a friend and he blames himself. If only I had been there instead of him. We start to even blame ourselves. I'm shameful. I'm bad. I deserve to die. Go ahead.
And I'll even add to that. Sometimes, not only let's say the bully or a parent or whatever the case may be, this might be 30 years in the future. They might not
Sure.
even be with us. There's no way that they could even have the change of heart. So what are you going to do? Have that, that imprinted belief pattern for the rest of your life, affecting you because that person's gone?
Absolutely. And so, regardless of the situation, a lot of times, yeah, a lot of times people spend their whole lives just trying to get their dad to apologize or say they love them. And part of EMDR takes from other therapies, but if we start to work on what's going on inside of us, because we can't control the behavior of other people, we can't control what happens to us in the world. Not completely. We can try to stay safe, and our nervous system is doing that. But what happens with any event, whether it's a traumatic event on a 10 to something, what you said, almost innocuous, you didn't even realize it. So I would call that like a behavioral pattern of the family, or a behavioral pattern of the school, or a behavioral pattern of the culture. It may not have even been traumatic or registered as traumatic, but you started believing something maladaptive to your life, which is not true. And those can lead to anxiety, depression, relationship problems, um, startle responses, everything in the post-traumatic stress disorder diagnosis group, which I won't go into, everything with that, nightmares, insomnia, just so many symptoms it can lead to. And it can even lead to what people get diagnosed as is bipolar, anxiety disorder, major depression. Yeah, those things happen, and there's biological causes for a lot of those, and there are circumstantial causes for a lot of those. But sometimes it actually was from something that happened a while ago, and then another thing confirmed it, and then all of a sudden we're in that downward spiral of the biological diagnosis. So
Which
what EMDR, what's that?
and in some cases, you can look at that and say, isn't that a little empowering? Because if you're dealing with some of those things and you just say, I'm broken, I don't know
Mm,
what's wrong with me, I'm broken. Well, all of a sudden, if you start to realize, hey, what if it is related to just something that happened? If I can effectively undo the effects of what happened, maybe I'm not so broken after all.
exactly. And so that's what the EMDR gets to. The reprocessing. Francine Shapiro once said in an interview, if I could have renamed this therapy, but it was too late because it had already taken off and had all these studies, she would have just called it reprocessing therapy. We're reprocessing events. And a lot of times we want to avoid those events. That's a symptom of having a traumatic event or a bad time. You don't want to go back and think about this bad thing that happened or this negative belief. We don't want to confront that. We just want to avoid it and go, no, I'm fine now. I've overcome that. And yes, you have overcome that. You have been resilient. That's how you're still here. However, we have to reprocess it for the nervous system to relinquish its hold on the behavioral pattern, and for the maladaptive cognition to become a positive cognition, or at least a neutral cognition. So when we go back, we use, it started with eye movement. And there's lots of theories on why when you're asleep, we have rapid eye movement back and forth, right? We don't exactly know completely why it works, but we do know that it works, and pretty much everyone who's ever had it done to them will tell you it works. It's really bizarre, but it does work. We have also learned that it's not just the eye movement; it can be bilateral stimulation. So sometimes you can have either somebody, tapping left and right, or holding on to buzzers, and you confront these memories. You confront feelings you have about yourself. You confront whatever it is you're bringing in, you confront in a very healthy therapeutic environment with your therapist, with goals for the future, but also a template to help you overcome what the behavioral pattern is, what the negative thought is, and moving into what is actually true. And what is actually true, if you've been in a car accident, is red cars aren't the enemy, and you can drive safely. But on the other side, it is dangerous to drive. So how do we exist in that middle realm? The middle realm helps us function and go about our life. What's true? There are bullies, and they do say negative things, but not everything a bully says is true or should be taken as fact. And that people do value you, but you might have to find different friends. And that, yes, that person who broke up with you, they're entitled to break up with you. They are entitled to whatever they want to do in their life, and they have decisions. But it doesn't mean you're unlovable. It doesn't mean that you're shameful. It doesn't mean that something's wrong with your body. It means that it may not be the right fit. And you can say, whatever negative thing, you can reverse it. I am good enough. I am lovable. I just haven't found the right person. And if it was a parent or an adult, it's very unfortunate when adults hurt children, or hurt you even as a friend or colleague as an adult, and people hurt each other. And it can be very devastating to a person, whether it's physical or verbal or mental or whatever it is. And we have to learn that this doesn't, whatever they did to us is not a fact about us. It's not a character judgment. And so with EMDR, it's, I don't know how to explain it, because you're not just thinking differently. You're going through the reprocessing, and it's experiential therapy that you have to let down your guard. You have to experience it, and only you can talk about your experience. And then through that experience, all of a sudden your brain starts making new neuronal connections. It starts doing it itself. It's not the therapist going, look at this list. See this negative thing? Now let's think positive. It's nothing like that. And I know some people have been to therapy like that. It is not like that at all. It is very much you in control, but you're in an experience for maybe 40 to 50 minutes of the therapy that day, or 30 minutes of the therapy that day. That's not just a talking session. And you're doing the reprocessing, and then your brain wants to heal. Your brain wants to go through the nervous system. It wants to release those maladaptive stored coping skills. Your brain knows how to heal. Just like when you cut yourself by accident, eventually, if it's not a giant gash that needs stitches, the blood will coagulate. You'll have a scar, you'll have a scab, and eventually it'll heal over. Your brain and your nervous system are the same way, but they need tools and they need guidance to be able to self-repair. And so EMDR guides that process.
And what I found was really incredible about the process, because I honestly, going into it, I thought it was going to be almost like, okay, here's a list of what happened. Now, what do you want to glean out of it?
Right.
But it was not that at all. I was actually remarkably surprised how little intervention my therapist actually had. She was more of a guide to say, she was prompting, here's, okay, let's try this, prompting the steps, but then I was in control of the whole thing. And it was really remarkable. You say the brain wants to, go through that healing process. It's absolutely true. And it's completely guided by you. And, I look at it kind of like in naturopathic medicine, and you know this quite well as well, Paul. If this is balance, we're completely strong, stable, we're able to stand. But eventually, if there's, there's stress at work and poor diet and all these things, and now we're out of balance, but we're still standing. It's just a lot harder to stand at an angle than it is to stand up straight. If you give the body the right environment to heal, it knows what balance is, and you can restore homeostasis and get back into health. And, you fix the diet, you fix sleep patterns, exercise, mental health, all these things, you get back into balance. So this was really a remarkable therapy in the sense that it's not guided in that, okay, well, what does that mean? I didn't have to I didn't have to think about, well, what could it mean? It just happened, and I think that's also one of the reasons why it was so effective, because again, we operate differently. Well, what I think was really amazing about EMDR is that it wasn't just a cognitive process. It wasn't just, prefrontal cortex work. It was really entire nervous system. My digestion improved after the first session, and it was just like, what? How is that possible? It was one of those things that even surprised me. And
it's amazing. Keep going.
Yeah, it truly isn't amazing. Now, we wanted to circle back to EMDR for high performers.
Oh, yes.
So what would this look like?
So, that's where I think EMDR can take people to the next level of whatever they want. Because most high performers are excellent at gathering information, at understanding concepts, at logical or emotional reasoning, at finding a goal and working their butt off to complete it. A lot of high performers even if they're kind of more of an artistic type that may not have like a set schedule, they still have goals and metrics. And they listen to the podcasts, and they watch the videos, and they read the books, or they read the cliff notes of the books, and they meet with other high achievers. So it's not as if they are struggling with information or how-tos. And so often regular counseling, which offers reflection and healing and different existential modalities, that might not even be appealing to them because they already have possibly mentors or friends that they are meeting with, or coaches, executive coaches or athletic coaches to talk to already about that. Now, counseling, I think, could be great just to work out some of the meaning, especially if you're a high achiever or wanting to be a high achiever. But EMDR offers something that all of that stuff does not, which is a change in the felt experience of your body and your mind in a way that's clarifying, completely natural, and brings you into your highest level of performance. So I still go to EMDR therapy today. Not every week, not all the time, but I go for stints at a time to work on actually my high performance, because I've been changing roles and becoming more of a public speaker, more of a teacher, more of a trainer, more of a mentor. It's a whole different ballgame than counseling and being a clinician. So, and a business owner as well. So I find myself going, okay, why am I doing that? Or why did I not do that? Or what went wrong here? Or how could I have done that better? And as a person who is the leader, the supervisor, the trainer, the owner of a business, the director, I don't have a lot of people giving me performance reviews besides my mentors. Okay. And even that, they don't own my business. So I need feedback. And when I get feedback, sometimes I'm puzzled. Okay, what went wrong? What did happen? So EMDR has helped me discover, okay, there's other ways. It's not just reprocessing past memories. Okay, there's a whole, you can use the EMDR tools on, okay, when they said that, this happened, then whatever, I felt this way. Okay, you can do whole interventions on why you felt that way and discover, yes, there probably are linked memories to it, but that's less of the point. The point is, okay, why did my brain think that way? Why did my nervous system respond that way? And the EMDR will tell you. If you sit and you and I brainstorm, why did my nervous system do that last week? Why did this happen? We could be sitting here for hours theorizing and not getting anything done because we're all up here in our frontal lobe here, and we're making logic, and we're making some connections, but we may not know. How about half an hour, 45 minutes, or even an hour of EMDR therapy, focusing on what happened and the felt sense of it, and floating back to different experiences and figuring out what our barriers are to growth? I mean, that's enough for about 2 or 3 weeks of conversation right there. I've found it with high performance athletes. Sometimes athletes will get into a strange habit and they don't know why. Whether it's a golfer who all of a sudden starts doing something weird when he drives or she drives the ball from the driving, or a weird putting thing, and they don't know why. It's just this, like, it starts to be like a nervous system tick almost, because they do golf, they play golf all the time, and all of a sudden they have this tick. EMDR can help that tick go away quite easily, and it's connected to something. May not even be a memory. It may just be a maladaptive state. But oftentimes when I've worked with athletes, I find out all of a sudden, actually, there was a thought connected to that. It was, oh my gosh, what's my score? I know my coach said, don't look at the score because golf is mental and you're not supposed to look at the score. But wait, what's the other guys doing and the other ladies doing on hole 6? There's other thoughts, or just pure distractions. And so the EMDR can help you get more into your flow state. Or baseball players who routine foul ball, can't catch it, start dropping it. They can lose their career over that. Okay, executives. Executives are in high-level meetings all the time. And there are a lot of dynamics that come into high-level meetings and talks, especially because you're meeting usually with other high-powered people, other managers, other personality types that may grate against you, people that may remind you of people from your past. Maybe you're having trouble managing stress. any one of those situations, EMDR can work on that in a way that uses the same thing that has been proven effective for post-traumatic stress disorder, all these anxiety, depression, everything we talked about with the traumatic memories and the nervous system responses. And you can focus with a good therapist who knows what they're doing, obviously usually highly trained, to work on all those little nuances and really improve performance, because you are facing not only what happened, what you're doing, but you are getting to a nervous system felt sense difference. So I've noticed, um, I had a physical therapist that I worked with, and they kept wondering why my shoulders were locked up, and I didn't know. I was like, they're like, "Are you, lifting certain things? What are you doing?" And I was like, "No, not really. I'm doing, stretching exercises and some light weightlifting." And I had a few sessions of EMDR where I felt that I had to hold it all together. That was like a subconscious belief I didn't realize. I have to hold it all together. I worked on that. All of a sudden, I went in the other week and they said, "Your shoulders are great. Like, what have you been doing?" I'm like, "Nothing different." "Oh, wait, I went to EMDR twice." So it's incredible because it's almost high level coaching, but it is therapy. But it's not your mental game, talking, reading books, cliff notes. It's not a how to. It is an experiential therapy. And if you could find a good clinician who does EMDR and can work on this stuff for high performance, you will be amazed at how your performance changes. And honestly, especially if you're not having a real rough time, it can change after one session. One session of EMDR, if you're a high performer, your performance can change on some issues. Absolutely. It won't change, like you won't go from 0 to 100, but you'll notice a performance improvement.
Yeah, it's really remarkable. And if you think about it, you know, I think any high performer recognizes at some point that there is a massive mental game that goes into it. And you can practice your free throws, you can practice your action, and you need to. But in
Absolutely.
those clutch moments, like, what is the difference between the guy that takes and makes the game winning shot versus
With
the
everyone
one?
screaming at him and
Yeah,
national television and all
right,
that. Right.
exactly. I mean, you see it at the end of basketball games with free throws all
Oh,
the
yeah.
time, right? You just look at the screen, you look at the guy's face as he's dribbling the ball,
Mhm.
he's doing the practice dribbles before he's about to take the free throw, and you can just tell sometimes, like, oh, he's gonna miss. Or with field goal kickers in football, you just
Oh,
look at
yeah.
the guy's face, you're like, oh, he's gonna shank it, and he does, right?
Yeah.
And
It's
it's that
emotional. It's mental. It's emotional.
it
And it's
is. You might have
physical.
done that action thousands and thousands and thousands of times, but in that context, based on the circumstances and the thoughts that are going through your head and whatever might have triggered you, you you have to train for that moment almost in a different way. And ultimately, what do I talk about on this channel a lot, right? It's you hear it in the beginning of the Dr. K show every week. Like, if you know you need to get out of your own way to execute on your passions, it's getting out of your own way is entirely a mental game, right? It's self-criticism. It could be a bunch of other things. But Paul, I want to switch gears a little bit and let's get into trauma-informed counseling.
Oh, yeah. Let's
Tell
go
us what
there.
that's about.
Well, trauma-informed counseling is, I think, an amazing way of viewing your average counseling session to your advanced trauma-specific intervention. And trauma-informed counseling is something where the client is educated on trauma and the effects on the nervous system. Even if you don't have trauma, it all helps understand, because it takes away, if you know that when your nervous system is impacted from various events, whether they're traumatic or whether it's just your childhood and your culture and your neighborhood or your relationships, and you know that the nervous system responds in certain ways to certain things. And a lot of times the nervous system, what it does when people don't like their behavior is it's overcompensating, or it's over responding to what it sees as a perceived threat, even if the threat's not there. So if you learn that that's actually what's happening from a scientific perspective, you can start to understand your body, your mind, and your physical reactions better. That takes away all of this self-loathing, all of this shame, all of this blame, because you understand why there are other reasons besides your willpower and your character that these things are happening. It all started, it didn't all start, but one of the biggest ways, I think, for people out there, for the notes, the Adverse Child Experiences Study, which took place at the Kaiser Permanente Institute in San Diego with just basically your average patients. And they gave them a very small quiz, the Adverse Child Experiences quiz, and to find out what their score was. And what they found out was the higher the score the person had of adverse child experiences, the more it was linked up with obesity, sexually transmitted diseases, smoking, drug, alcohol use, anger, depression, anxiety, you name it, physical problems, not just mental health issues, were increased exponentially. And then they did a lot more studies on it from there. But basically, they found out that experiences matter. And so a lot of times in our culture, they'll have, I don't know, an annoying thing that they do, right? And people immediately think that that person's in control of their actions, and they go, I can't believe that. I would never do that. That's a shaming behavior. Actually, we're all capable of doing annoying things or negative things. But for all we know, that person is responding to something internally. They need to work on it for sure, but it could have been from some sort of traumatic event. Or just their own experiences. So trauma-informed is a lens of counseling, and I'm not really even reading the definitions. You can read it on our website at the Trauma-Informed Counseling Center of Grand Rapids, Health for Life GR. We have a whole definition of it. But it's bringing in the science that's been existing for at least the last 20 years, if not longer, about the nervous system, about how the body responds, and how that manifests in our behavior and in our actions, to educate the client so that you have a perspective that frees you from character judgments, blame, self-loathing, and all of that. You still may have a problem. You still may have a behavior that you need to work on, and that you could work on with EMDR or other trauma-specific interventions, or even just counseling or coaching or whatever. Or you may have something you don't like, that you get startled too much. You may have these things about you, your unique characteristics that you don't love. But you don't have to blame yourself for them, and you don't have to make up stories for them. A lot of humans have been making up stories. That's how we survived, for thousands and thousands of years. And when things happen, people make up stories all the time. But if you have a trauma-informed perspective and you know the science behind it, you don't have to make up stories. You can start accepting yourself for who you are, for what happened to you, for where you grew up, all the difficulties you've been through. And you can start accepting your faults, and that is the step toward starting to feel better wherever you're at. And that acceptance of self, and that acceptance of
I mean that's
knowing.
the ultimate goal, I think, in life. If we really want to get philosophical here, is it all boils down to accepting. Because if you can figure out, right, how to accept yourself, what does that mean? First of all, that means that anything that happened to me in the past and whoever I am today, there's something about myself I don't love, all these things that might be there. If all of a sudden say, I am who I am what I am, and I love that about me. If you accept that diagnosis, whatever you might be dealing with, but you accept it and you say, this is me. Now, what this unlocks is your ability to say, okay, now that I have accepted that I am who I am, that I have this past, that I have these characteristics, now how can I use that, right? How can I use that? What does this allow me to do that I could not have done otherwise? Because a lot of the struggles that we don't learn superpowers, right? We don't learn the things that make us great through, schooling and, these events. Like, no, it's the challenges in life that we've overcome that make us tough. It's those challenges that give us those superpowers that allow us to be great for other people. And it starts with acceptance of where you are and who you are. So yeah, you can change some of that for sure, but it's part of, but you first still have to accept where you are. I had to accept where I am to say, okay, I need EMDR. If I didn't accept, that's why I wasn't getting help before, because I was like, I don't need that. I
And
didn't accept where I was at. I didn't accept who I was.
I even want to bring in another word, not only because I feel like sometimes people say, you need to accept this. I think we need to accept things, but I also think we need to allow things.
Yes.
So sometimes it's not just like you have somebody and they say, oh, my so-and-so, my friend, my husband, my wife, or my partner, they won't get into counseling. They need help, but they won't accept it. They won't, but they also won't even allow the idea of having someone else help them, or having going to a doctor or going to a therapist. And so sometimes we have to do both. We have to accept, but the beginning of acceptance is starting to allow that maybe this is where I'm at, before fully accepting it. Because I think people are afraid to accept it, because they think, if I accept where I am, what does that mean about me? Does that mean I'm weak? Does that mean I failed? Does that mean that I'm just incapable? There's all these negative beliefs people hold. So how about you start with allowing thoughts to come in and allowing experiences to show you, shifting from your ego state of defense to openness, and knowing that there are people that want to help you. You may not be living with them, you may not know them, but there are people that want to help you. And once you receive some type of help, it is amazing what you can do. Because we all need help from somewhere. We all have blind spots. We all have troubles. So what is holding us back? Oftentimes it's accepting, like you said, where we are and dealing with reality, not what we think should be happening right now, but what is happening right now. And that takes bravery, and that takes showing up, and that takes honesty. And when you start with that, which seems for some people like a defeat, that is a victory. That's your first victory in a series of victories. And you will find the tools and you will find the helpers that make sense. And you will get out of those childish, I'll call it childish, ways of thinking that you have to do everything on your own. Okay? There's, I think that's in our culture. We have this sort of, I did this, I built this individualistic type, like idol worship, I think. And it's just simply ridiculous. Anyone who's ever accomplished anything, no matter from your top athlete to your executive to your artist, they have people in their lives that have helped them in some way. If they recognize it, good for them. If they don't, they're in denial. So we all need help from somewhere, and it starts with accepting where we're at right now. Where are my weak spots?
That was awesome. I was gonna try to land the plane, and you just took it right for took us right there. That was awesome, Paul. Why don't you let us know a little bit where people can find you?
Well, right now, my main website where people can find information about me is www.healthforlifegr, as in Grand Rapids.com. Health for Life Grand Rapids, if you Google it. If you want to know about my podcast, The Intentional Clinician is the name of the podcast. And you can find The Intentional Clinician on any podcast application, including Spotify and iHeartRadio, which are two of the outliers on those. So you can find that. I usually post an episode every month. Social media, I have somebody helping me with that, and that's at Health for Life GR. That's on Instagram and Facebook. And that's where I'll post things. And of course, the Trauma Informed Counseling Center of Grand Rapids, if you go to the Health for Life Grand GR page.com, you'll find it. You'll find a link right on there for trauma informed counseling. You can read all about what is trauma informed counseling, what are the different types of interventions, what's available, and you can just get education on that from our site. Or if you're in the area, you can actually find a clinician that specializes in something that may be able to help you.
Awesome. Well, thank you, Paul. And I will have a link to all that stuff down in the description. Well, this was a lot of fun, and I hope to have you on again, and we can dive deeper into some of these topics. I feel like we only grazed the surface on some of them.
I agree. Yeah, we could have probably talked all day. And if you're out there in YouTube land and you haven't subscribed to the Dr. K Show, I'm going to say hit the subscribe button right there. Let's do
Why,
that.
thank you. Appreciate that. Very well done. Very well done. Until next time, my friends, I believe in your greatness. I'll see you soon.